Welcome to the Dr. Janine Show. I'm Dr. Janine Bowring. It's so great to have you all here. We have an exciting show planned for today. I had a bunch of questions on TikTok as well as Facebook, so we're going to be talking about calcium, the different types of calcium, and what your body may be telling you if you're calcium deficient and why you may need to look at supplementation, which is often a big misnomer that you're getting enough calcium, especially from dairy products, so we'll talk a little bit about that. I'm also going to share the difference between leptin and lectin. So there's a lot of confusion here, and it's been in the news, especially a few years back, people talking about lectin and the problem with lectin. And of course, I talk a lot about leptin, so I'm going to clear up all of that confusion for you all. And if you're new to my channel, welcome. I'm Dr. Janine Bowring, naturopathic doctor. We stream live here every Monday at 12 noon Eastern Standard Time. And I answer your health questions, so it's a really fun show. Make sure you stay tuned right until the end. I hope that you're not skipping class or skipping out on your Zoom meetings and things if you're at work, but please do stay tuned. We have a fantastic show planned for you today. I will answer your questions live, and we'll do some shout outs as well, but we also have a quiz coming up, and in our quiz every week we have winners of the Dr. Janine mug. So all you have to do is participate. Even if you don't get my quiz questions right and correct, you still have a chance to win. You'll be entered to win and we'll send this out to you, the Dr. Janine mug, which is an exclusive thing for you to have in your home. And, welcome in. It's great to have you all here. If you do have questions and comments throughout the show, please do leave them no matter what platform you are tuning in on. And bear with me because I try to do my best with all the technology around me. So we've got some new fun things for everybody watching on TikTok. We're going to show some of the assets that we show, which is, the pictures as we go along, to show the visuals as to what I'm sharing in today's show. So this is fun. And I just lost my feed. Oh no, I got it back. So hello to Mandy Page. Nice to see you. Hi, Aaron. Hello to NPS. And yeah, great to have you all here. I hope to get to all of your questions throughout the show. Make sure that you are putting them in. Sometimes you have to type them a couple times to make sure that we see them, but I have my team here behind the scenes as well to help me if I miss anything. And whether you're coming in on YouTube or on Facebook, it's great to have you all here. And I appreciate a big thumbs up, and also after the fact, of course, sharing this with your friends so that other people get to know about the fact that we go live every Monday. It's really fun and interactive, but this show does exist then on YouTube, so make sure you're following me on YouTube. Just look up my name, Dr. Janine Bowring, and you will see all of our videos there. So whether it's from our live show or the different segments that we tape every week, we upload something new every single day. And you'll love our new binaural beats and relaxation music that we have to help you to get to sleep, because we know that sleep is so important, especially for leptin resistance, which we'll be discussing, and that's coming up very soon. So really important that we take care of ourselves and, of course, do it naturally. And that's what I'm all about as a naturopathic doctor, and many, many years of experience in the field of natural medicine. So here to answer your questions live. So let's get right to it. Let's talk a little bit about calcium. So I had a bunch of questions on TikTok in particular about the different types of calcium. There's so many different types of calcium certainly that you can take as a supplement. And first, how would you know that you even need calcium? Well, it's a huge misconception that you actually get enough calcium from dairy products in terms of absorption. Yes, they're high in calcium, but to actually absorb that calcium is another factor. And because dairy products don't give you that highly absorbed or bioavailable type of calcium, it's very difficult, especially if you have compromised digestion, you don't break down dairy products very well. It could be, that now you're running into a calcium deficiency. And how would you know? Well, here's some of the symptoms or signs that your body would be telling you that you're low in calcium. So weak, brittle nails. If you can't grow out your nails, and I know a lot of people, especially women, who are suffering right now. We haven't been able to get our nails done, and we're trying to deal with things on our own. So that is a challenge. But yes, this too shall pass. We will be able to get our nails done again soon, hopefully, and depending on where you're streaming in from. So yes, I'd love to hear as well, especially if you're in a different country. I'd love to see your flags when you are streaming in, especially on TikTok. That would be awesome. As well as other signs of calcium deficiency would be sore joints. So if you have a lot of joint pain, that could actually, and this is a knee joint, and if you get a lot of joint pain, that can be an indication of low calcium status in your body as well. So it's important that you up your calcium, as well as weak bones. So certainly if you have osteopenia, osteoporosis, that would be an indication that that absorption of calcium is a problem, even if you're taking calcium. And that's why we're going to look at the different types of calcium supplements today, and I'll really break it down for you. Insomnia. So calcium is super important for our melatonin, and because I always say to take your calcium closer to bedtime and your magnesium in the morning, which goes against what most people say about how and when to supplement your magnesium and your calcium, but you need your calcium to help with your melatonin. And you'll find that you have a deeper, more restful sleep when you actually start to absorb that calcium from, if you are going to go with a supplement, the right type of supplement, but doing it closer to bedtime can be really helpful for that. As well as eczema. So skin conditions can be related to a lack of calcium, and as well muscle aches and cramping. So we know that magnesium and calcium work together, and when there's an imbalance, it's important to find that balance and taking the right types of magnesium and calcium. Of course, not taking them at the same time, but ensuring that that proper calcium metabolism and magnesium metabolism is happening appropriately. This is really important. As well as confusion, even memory loss. So we need calcium for brain function and for the neuroconnectivity of the way that our neurons are firing. So that's really important. Even to go as far as depression and hallucinations can be because of a calcium deficiency. Now, even for weight loss, so for people who have difficulty with losing weight, or maybe you're gaining weight and you're not sure why, and studies have actually been done on this, particularly in women, that if we are in a calcium deficient state, then we go into something called lipogenesis, meaning the making of more fat. So that's not something that we want. Of course, we want to ensure that we're getting enough calcium in our bodies and to get it in a properly absorbed form. You know, I'm going to talk about the different types of calcium now, and we're going to really break it down for you and why, you know, there's a certain type that I like, so I will be sharing my absolute favorite type of calcium supplement to be taking. So make sure you stay tuned as I'm going through all these different ones. So a few shout outs. Let's say hello to Natalie on Facebook. So great to see you. And hello, we have a question from Shelly on YouTube. So for hair loss, it's growing back. I can see that the hair is coming back, but it just won't stop falling out. So for hair loss, calcium. So we're actually talking about calcium today. You have to make sure that you don't have a calcium deficiency. Also, some of the top things that I think about with hair loss are essential fatty acid deficiency, vitamin D deficiencies. So depending on where you live, this is really important, especially through our cold winter months here in Canada, where we tend to be very low in vitamin D. And also I think of iron and thyroid. So it's a multifactorial thing when we're talking about hair loss, but those would be some of my tips. And I believe, do we have some, maybe that's another future show that we can work on hair loss. We will do a video on that for you to help with some very specifics as to how to help with hair loss. A few more hellos. I'd like to say hello to Love Wind, Roxanne, nice to see you. Rose Sue, nice to see you. And hello to Mike and NPS, Mandy Page, Aaron. Hello, everybody. So it's great to see you all on TikTok. And I see some of your questions here. So yes, I am from Canada. I had that question, which is awesome. And let me see where you guys are all from. Guys and gals, of course. Sharon, nice to see you as well on TikTok. If you've got health questions, Roxanne, you're asking about multivitamins. I will share some links for my favorite multivitamins in our YouTube show. So make sure, you know, on TikTok this show goes away, but after the fact it will live. So it will live on YouTube. So make sure you're following me, you're subscribed to my YouTube channel, Dr. Janine Bowring, and you can look up just about any health topic and you will find the information there. So that would be fantastic for you to be able to see the archived, but also we share links, and that's, you know, if any type of supplement comes up that I recommend, then we'll share the links to those supplements. So we'll make sure I will put the multivitamin. I like whole food multivitamins, fruits and veggies from Nature's Superfoods. That's how I get my multivitamin personally. Okay, so let's talk about the different types of calcium. So the first one is calcium carbonate. So this is the least expensive type of calcium supplement, and it's about 35% or lower of elemental calcium. So when you're taking, let's say, 1,200 milligrams of calcium in a supplement, usually they will not tell you how much actual calcium you're getting in that dose, which is a pet peeve of mine, being, and knowing a lot about the vitamin and supplement industry as an expert, that, I think on the label it should disclose how much actual calcium you're getting. So that's something to look for on calcium labels. And calcium carbonate being the least expensive type of calcium, it is sourced from stone, rocks, so it could be marble, limestone, usually the least expensive way that they can, harvest it. That's what, these companies are going to do. But also, because it is so cheap, it can be a little bit irritating to the digestive tract because of the source of the rocks or the stones, that it can be a little bit harsh for your digestive tract. So it's not my favorite. It is probably the most popular that's out there because it is inexpensive, and it needs stomach acid to be absorbed because it is more alkaline. So that can be an advantage, that can be a disadvantage. Okay, let's go to the next type of calcium, calcium phosphate. So this is about 30% elemental calcium, so not great in terms of bioavailability. Also comes from rocks, and sometimes it can be also derived from cow's milk, and again, not the best bioavailability, probably my favorite type. If we can go to the next one in terms of, and if you're just tuning in, great to have you here. I'm Dr. Janine. Today we're talking about different types of calcium. This is the Dr. Janine Show. If you've got questions or comments, I'd love to hear from you. We're streaming live on YouTube, Facebook, and also here on TikTok. So it's nice to see you all, and I would love to, hear your questions. We also have a quiz coming up, so make sure you stay tuned for that, and you can win a prize. Okay, so the next type we'll talk about is calcium citrate, or it could be called calcium citrate malate. That's another version of calcium citrate in which they use malic acid, or they're using citric acid, plus again the source is going to be rocks, and using that rock source with these acids is now an acidic type of a calcium supplement. But here's the problem. Again, not great bioavailability. It's about 20% max of the elemental calcium when you're getting it in this format. So probably, again, not my favorite. Another one is calcium lactate, and this is only about 13% bioavailability, 13% of the elemental calcium. And this can come from aged cheeses, and also baking powder is a source of the calcium lactate. So interesting. As well as calcium gluconate. Now this is another type. It's very expensive if you were to be given an IV of calcium if you have hypocalcemia. So if you have low calcium, this would be given an IV. In terms of an oral supplement, it's only 9% of the elemental calcium, and it is very, very expensive. So probably not my recommendation. And now let's talk about my favorite. That's going to come up in just a second. Hello, shout outs to Chris on Facebook. Nice to see you. Okay, that's a great question. I will get to that in just a second. So Chris has a very specific question about kidney stones and calcium. Good question. I'm going to get back to that in a second. So my favorite type of calcium is coral calcium. And the reason being is that it has a super high bioavailability, which is great, up to 38, sometimes higher percentage of the elemental calcium, but also has great bioavailability, and the studies show, so I don't know if we have the study, if we can show that really quickly. This one study showed that, in terms of calcium absorption from ingesting a coral-derived calcium, showed that, and they compared it up to the calcium carbonate, which is the most common and the least expensive type of calcium supplement, that yes, that the absorption in the intestines was better for the coral calcium. And I know that, in terms of coral calcium, you have to be very aware of the source of the coral calcium and to make sure that there isn't any, problems in terms of contamination with the coral calcium. And because it contains other trace minerals, and that's one of the reasons why I love the coral calcium, is that it has up to 69 other trace minerals, things like boron, rubidium, that are also alkalinizing to the body. And remember, it's all about the absorption of that calcium, alkalinizing to the body, but also helps with the absorption of that calcium itself, and that's naturally occurring in the coral. Again, when you're choosing a coral calcium supplement, it should be above sea level fossilized coral calcium, which is sustainable. It's not going to deplete the oceans of the coral and helps with that alkalinity in the body. And that's why, it's something that I make sure that it's radiation free. So that's really important as well, that there's no radiation, which was always the concern with coral calcium. So back to Chris's question on Facebook. Yes, the concern about kidney stones and using a calcium supplement. So when it's from a whole food source, then your body knows how to utilize it, and taking it in the right dose. Certainly you can overdo it with any type of, calcium supplementation, but ensuring that you also have some of the cofactors. So vitamin K2 is very important, as well as, making sure that you're also taking magnesium. I would probably never suggest for anyone to take calcium without offsetting it and helping with that magnesium. That magnesium is really important to take, a highly absorbed type of magnesium. And, I've got other videos on this, so make sure you check them out on my favorite type of magnesium. And taking the magnesium in the morning, because the calcium and magnesium work hand in hand to ensure you get that proper absorption. This is really important. So magnesium in the morning, calcium closer to bedtime. You want to take a vitamin K2 at some point, if it's not every day, it's at least a few times a week. And then your risk for the kidney stones, you don't have to worry about. Now, that's a blanket term that I'm saying, but getting the right type of calcium is really important. And it depends on your metabolism. It depends on how healthy your diet is. It depends on your activity levels. There's so many factors that go into the kidney stone formation, but taking the right types of these supplements is so important, and that you can rest assured. Okay, so I have some more shout outs. Hello to Melanie on YouTube, and dosing questions I hopefully will get to later. If not, I can answer in the comments. Also, hello to Dove and Auntie, Tanya as well. Okay, a question about calcium from algae. So the bioavailability isn't always the best from algae sources of calcium. It's not something that I have personal experience with. I've always liked, and the studies showed in terms of the calcium from coral calcium is better, but again, when we're talking, I haven't personally taken the algae sourced calcium, so yeah, that would be something that you'd have to have personal experience with. And I have not looked at the studies on that. I know that some companies will do studies on the algae type of calcium, but I've not looked at them, so that's nice to see you. Okay, so now we're going to talk a little bit about leptin and lectin. So I had questions about what's the difference between leptin and lectin. And certainly when we're talking about leptin resistance, this is something that I've talked about in previous videos. We did a whole show on this called The Science of Weight Loss, Leptin Resistance. And leptin is something that is secreted from our white fat cells. And it's a hormone, and what it does, it is the messenger that tells the brain if we are in a fed state or a fasting state. So basically it's a survival molecule and it's a hormone that's giving information to our brain so that our brain knows what to do in terms of fat burning, searching for more food, being hungry, eating more, eating less. And what the problem with this is that there's something called leptin resistance. And with leptin resistance, unfortunately, what's happening is that we have difficulty with that feedback loop of the brain. And what happens now is that our brain is not getting that signal that we're in that fed state. So what we want to do is we want to fix that leptin resistance. Now this is very different from lectins, and lectins are something that I'll get to in just a second. Lectins are something that is present in food, and probably about 30% of our food contains lectins. So leptin, if you missed, my post, I actually posted this morning on leptin resistance and 8 tips as to how to fix your leptin resistance. So make sure you check that out on TikTok, but also we will be doing videos, and we have a whole show, like I said, the science of weight loss, leptin resistance on YouTube, so you can check that out. It's so important. So early morning sun is important in terms of fixing that leptin resistance. This is something that I do my very best every morning, even if it's an overcast day, is to get that early morning sun into my eyes so that I can, set my hormones for the rest of the day. And believe it or not, this is what helps your sleep at night, is getting that early morning sunlight in your eyes. So you saw, in this picture that the sun was very bright on that morning, so I have my eyes closed. Of course, we want to protect our eyes because our eyes are actually a part of our brain. So that would be a good quiz question. So just for those of you that are listening, it's not going to be today's quiz questions, which are already posted, and we'll be getting to those in just a second, so make sure you're staying tuned. But yeah, that's a good question. Which part of our brain is on the outside of our body? It's our eyes. So that's going to be coming up. So for those of you who are going to tune in every week, you have a chance, of course, to answer that one correctly. Okay, so lectin. What is lectin? So for those of you who have heard about lectins before, this was popularized a few years ago. And supplements were made, in terms of lectin and having problems with digesting lectins. But lectin is a protein that binds to carbohydrates, and it's present in plants in particular to make the plants more resistant to pests. And the unfortunate part about lectins is that they can cause digestive upset because of that, their structure is that it can be very irritating to the gut and actually can lead to leaky gut syndrome. So I have a whole video all about leaky gut syndrome. Be sure to check it out if you missed it, The Science of Leaky Gut, everything you need to know about leaky gut syndrome. But I'm going to show you a little demonstration here as to what the problem is potentially with lectins, and I'm going to, tell you what some of the most popular, lectins that we could be eating in our diet and why they can cause and be related to the leaky gut syndrome. But I have my little demo here, which I use on television when I'm on television here in Canada. And I hope to get back there soon. Because of the pandemic, we've been, on lockdown, and it's been a problem. But if you can imagine that this is our intestinal brush border in the small intestine. So this is healthy. This represents, those intestinal flora. This is a good thing, something that is good for us. Now, what happens if we are eating foods that can cause irritation to our gut lining? And when you hear about leaky gut syndrome and you're not sure what that is, well, what happens is that those tight junctions, so right now the tight junctions are good, everything is nice and sealed up, and it allows for the right size particles to move through into our digestive tract. But now what happens with leaky gut syndrome, and this is a gross exaggeration, is that those tight junctions can open up, and what that means then is that those undigested food particles can now flow through the intestines, and it's not the greatest thing for our immune system. So when there's a link between leaky gut syndrome and having autoimmune disorders, autoimmune thyroid disorders, which I get a ton of questions about, whether it's Graves or Hashimoto, so either low or hyperthyroidism, but also for bad bugs. So parasites, if you guys have seen me talk about this before, those bad bugs like H. pylori and other parasites and things, now you've kind of opened up the door for them to pass through as well. And that can cause a lot of inflammation in the gut, as well as other parts of the body, and infections. And this is not something that we want. We want to make sure that our tight junctions are sealed up. There's certain supplements that help us to do this, like zinc is a big one, and acetylcysteine. So keeping those tight junctions, healthy is a great thing. Now the problem with the lectins, so does anybody know what, the most commonly digested lectin or undigested lectin is? Well, it's gluten. So why do so many people have a gluten sensitivity issue? Well, the problem with gluten from wheat and from other grains that contain that gluten molecule, the problem is that it contains lectin. And because it can be irritating to the digestive wall, it can cause those holes to happen as well as other foods. So maybe we'll give you the list of the other lectin-containing foods, which could be our, beans. So this is really interesting. I didn't put two and two together until, when I was doing research for this show, because my mom used to always say, never eat. So when we would be preparing the green beans, just like we see here, when we were, getting them ready to cook, and I would, be tempted to eat them, my mom always said, never eat the green beans raw. They have to be cooked, and that's because of the lectin. Because the lectin has to be cooked, and as soon as you cook, then your lectin really decreases a lot, if not is abolished. And this could be also, in terms of other beans that you may be eating, but also peanuts contain lectins, as well as corn, and the nightshade family, like potatoes, tomatoes, and peppers, all contain lectin as well as vegetable oils and beans and legumes. So, all of these different food groups contain those lectins, which is very difficult to digest. But the good news is, as soon as you cook them, so if you cook your potatoes, then you will be decreasing the lectins. If you cook your peanuts, so roasted peanuts, and so I asked, one of our producers today, well, is peanut butter, because that's going to be a problem for me, is peanut butter roasted peanuts? And yeah, most times it is roasted peanuts. So if you're going to make your own peanut butter at home with your blender or whatever, just make sure that you roast the peanuts first to decrease the lectins. Because lectins, now let me just say that it's not that you have to avoid all of these foods, which is kind of what the news was coming out and talking about, avoiding lectins. Now, certainly if you have Crohn's disease or colitis or, it's severe inflammatory bowel disease, then you want to, and if you're celiac, absolutely you have to stay away from gluten. But, if you are someone who's wanting to get healthier, maybe you're wanting to lose weight, you can limit these, and certainly by cooking these foods, it will be better. But that's, not including the vegetable oils. So those, polyunsaturated fatty acids, those ones that how I feel about the PUFAs, not so good for your health. I talk about that in other videos because they're very inflammatory. And that's essentially when we have those, that damage to the intestinal walls, and with the leaky gut syndrome, this leads to inflammation. So it's something that you definitely want to do your best to limit, but cook these things, taking, vegetable oils, even if it's cooked, not so good for you. Making sure you're cooking your beans, your legumes very well, and it can't be in a slow cooker. So I learned that as well, that it should not be in a slow cooker. That's not going to be enough to break down the lectins enough. And, I think in my own opinion, the whole lectin thing is taken out of proportion. I think we can't stop eating. Some of the benefits of lectins is that it helps to slow down that insulin response from, spiking our blood glucose. The lectin helps because it's a fiber, and we need fiber for good bowel movements and making sure that we're not constipated. We need to have that proper balance of these, healthy fibers from the lectin. But yeah, by cooking these foods, which you normally would anyways, just don't eat those green beans. Just think of my mom, who said don't eat those green beans raw. Normally we would cook our beans and not eat them raw anyways. So, that's important to know. Okay, so let's get back to our questions. Hello, shout outs to Frank and Casey on YouTube. Hello, thank you for joining in. And Brock, how do we know, here's a question from Brock. This is a big question. How do we know that we're leptin resistant? Well, there's not really a test or a great test that will show you that you have leptin resistance. So check out my show on leptin resistance. If you have some of the symptoms, which would be overweight, if you've got inflammation in the body, if you have an autoimmune disorder, that would be another indication. Basically, if you're not doing, so if you're following me on TikTok and you look at today's video on TikTok, I want you to check out, if you're not doing the 8 things that I say that you should be in terms of leptin resistance, then quite likely you have leptin resistance. So looking at that sunrise in the morning, getting to bed and not, decreasing your exposure. Oh, actually, I forgot one. We should have another one on there, is the EMF exposure. For Brock, who's watching and listening, I hope you're not surrounded in EMFs because that'll mess up your leptin as well, which is really important. Getting a good night's sleep, making sure you should, decrease that light. So artificial lights after the sun has gone down, it will screw up your brain. I'm telling you, it's going to screw up your leptin. And this is like, it's not something that you would necessarily, notice right now. But when you're becoming, as you're aging, so into your 50s, your 60s, your 70s, and you start to have inflammation and cardiac issues and immune system is compromised, then that's maybe we have to take those steps now as soon as we learn the right information to really have those impacts on our health and on our longevity if we want to live that long and healthy life, which is so important. So of course I want to hear any other questions because we're going to get to our quiz in a few seconds. Okay, so perfect. I don't know how to pronounce your name. I'm so sorry. On TikTok is asking, I have Hashimoto's. Does that mean gluten-free? Yeah, so depending on where you're at. So I want you to check out my show on leptin resistance. Make sure you're doing all those steps to fix the leptin resistance. And the Hashimoto's is definitely really, for people who don't know, that's autoimmune disorder with low thyroidism. Yeah, watching your gluten. I would say you don't have to be 100% gluten-free. Make sure that you fixed your leaky gut. So that whole issue that I'm talking about, fixing the leaky gut syndrome, make sure that the leaky gut is repaired. And the good news is once you're watching your leptin resistance and let's say you take a period of time where you decide, okay, I'm going to fix and heal my leaky gut. The good thing is that our gut is good at repairing itself. So if we're not like inundating it with all of this, all these lectins from the food and stress and, not having and stopping eating. So watch the leptin resistance show because you have to stop eating at a certain time in the evening and to allow for proper digestion and repair to happen and for your metabolism to be working as you're sleeping. So I think you can get away with having a little bit of gluten in the diet once you've done that repair because your body's good at repairing, but you just have to foster that and you have to allow for that to happen. So I hope that answers your question. Aoife, that's how I pronounce your name. Thank you so much. So Aoife, I hope I answered that question. But check out my shows on YouTube. Make sure you're following me so that you definitely find some. And whenever people have questions, so you can direct message me. Make sure you're following me on Instagram so we check, where all of this information is coming towards me in terms of YouTube comments. You can ask me questions there. Also on Instagram, at Dr. Janine is my handle. So make sure you're following me on Instagram. But also if you're direct messaging me, then definitely, because I know some people don't want to ask, on public chats as to their health questions. And of course, I don't give any advice. I just give information and I can point you in the right direction as to where to go with some suggestions. So can Manuka, I think you mean Lisa is asking Manuka. I think you're asking about Manuka honey help with leaky gut. Yes, it can. So Manuka honey is very healing to the body. And so, yeah, so if you're just tuning in, I'm Dr. Janine, naturopathic doctor, and I'm answering your health questions today. So great to have you here. Hello to everybody on TikTok, as well as Facebook and YouTube. I'm so glad to have you here. So make sure you're answering these questions that are coming up in the quiz right now. Hello to Marie and Harvarinder on Facebook. Nice to see you here. Okay, so it is quiz time. Is everybody ready? So this is what you're playing for, everybody, and you don't have to get the quiz questions correctly answered. Just do your best. As long as you do your best and attempt to answer the questions, you have a chance to win one of my Dr. Janine mugs, Dr. Janine. We will send this out to you free of charge, and yeah, it's really fun. Soon we'll be having some other great prizes coming up, so continue to watch every Monday. We go live every Monday at 12 noon Eastern. We have our sponsors at VitaTree are going to be donating some prizes as well, so that's coming up, so make sure that you're tuning in every week. It's going to be fun. Okay, yes, are we ready? Okay, I gotta make sure. So is somebody gonna pass me so I can see the other answers? I need my other device. Let me clean this up a little bit. I need my other, oh, maybe not. Okay, because we're going to be going live with our questions now for the quiz. And I hope that I will be able to stream all of the, oh, somebody says that, yeah, I talk like I'm on the news. That's funny. I have a lot of experience on live television. So it's funny that some people pick that up, that they know that I speak like a TV person. Yeah, it's true, because I am on TV. Here in Canada anyways, if you have seen me, then maybe that's where you've seen me on television, talking about vitamins. So, okay, here we go with our quiz questions. Number 1, what does BFR stand for? What does BFR stand for? This is something that I talked about. It's a type of exercise as a little hint. Does anybody know what BFR stands for? Hello, Ellie Grace. Hello, Mysterious. Hello, Tik Van Talk. Hello, Carrie. Nice to see you all. Hello, Stephanie. I know you have a question. I'll get to that in just a second. Okay. What does BFR stand for? Does anybody know? Oh, John. That's a great one. Best friend forever. No, it's a type of exercise, but that's a good one. It's a type of exercise that I talked about in a previous episode. Yes, Sam, blood flow restriction. Wow, good job. Awesome, awesome, awesome. So, hello, Moses. Hello. Yes, NPS, you got it. Good job, blood flow restriction. I don't know. No user 3375. No, that is not right. And not Purple Gothica. Close, but no. Okay, so let's go on to question number 2. How many chakras do we have? How many chakras do we have? Anybody know? Anybody know? How many chakras do we have? And again, for those of you just tuning in, we are drawing for one of our signature Dr. Janine mugs. We will send out to you free. All you have to do is try to just attempt to answer the questions. You don't have to get it correctly, and you will be entered to win. So hello, how many chakras do we have? Yes, no name, you're correct. Purple Gothica, you are correct. Chad, you're correct. Tyson, I'm not sure I understand what you said, giving out chakras. Okay. And Hudaman, yes, you're correct. Everybody else got their answers in? Okay, it's 7. Some people say 8, so I would take 7 or 8. No, John, it's not 66. There's 7 or 8 chakras. Some people say a little bit more than that. What is a chakra? Kelly, a chakra is an energy center on the body. So for those of you who don't know, we have the 7 main chakras. Some people say 8. There's another one on top of the head. And these are the energy centers on our body. And it's important that the energy is flowing properly through our chakras. I have a Tik Tok on this, so make sure you check it out. I go through a little tutorial on the chakras and what they mean in terms of your health and why it's important in terms of mind-body medicine and energy medicine, which I love energy medicine as well as conventional and naturopathic. So I talk about, having the balance, and sometimes it's not because you have a vitamin deficiency, it's not because something you're eating wrong in your diet, it's really because your chakra's out of balance, and that's why you experience things in your body. And this is something that I experienced with my patients, for years and years and years, and helping to clear up energy in the energy centers, and doing all of the other stuff right, but still not getting the relief or a betterment in their health. And it was because of the energetic blockages, and that was sort of the last thing that we had to do to ensure, and that's what would make the change in terms of their health. So it's something that I really believe in, and I'm constantly making sure that my chakras are in good alignment and functioning, and I think it's important, and it's something that I can certainly, if you want to know more about it, just let me know, give me a big thumbs up, and I will definitely do a lot more videos on that. I don't think I've talked enough about energy medicine as much as, my own experience and how with my patients and my family members and how this is where it's at in terms of overall healing, especially for people who have very serious diseases. And, it's important to get the chakras balanced and get the energy flowing in a positive way. There's so much negativity these days that I think we definitely have to focus in more on this. So if you want to hear more about this, please leave it in the comments. Also, I want to hear from you. Put it in the comments here. And Jose, I'm seeing lots of hearts, so that's good. I think that's a good thing. Somebody's asking if I'm a New Age doctor. I don't know. Am I a New Age doctor? I'm a naturopathic doctor. So, yes. And functional medicine, love it. And there's some loopholes in functional medicine, though. They don't talk enough about certain things, which I like to fill in the blanks in my shows. Leptin resistance is one of them that isn't really recognized enough of in functional medicine, in my opinion. So that's why I like to educate. Okay, so hello, Jim. Hello, Magnolia. Thank you for following. Hello, everyone. Okay, and Matthew, you have a question. Okay, let's do these quiz questions first. I don't know if we'll have a bit of time left at the end, and I'll try to get to some more of your questions. Okay, because I know Stephanie has a question as well about magnesium stearate in supplements, so I hope to get to that as well. Okay, what is the main mineral found in Brazil nuts that helps with the thyroid? What is the main mineral that's found in Brazil nuts? Thank you very much. That helps with the thyroid. Does anybody know? Okay, does anybody have it? I am checking YouTube. How are my YouTube people today? Are you answering? Yes, somebody wants to hear about chakras. That's awesome. Okay, where is my commenting? I don't see my commenting, guys, on my Facebook. It's not here. Somebody has to fix my screen. Thank you. No comments showing. Thank you very much. Okay, there we go. Okay, so what is the main mineral? Yes, Reina. Good job. Magnolia. Yes, you are right. Lisa, you're right. User 3375, you're right. You guys are so smart. NPS, you are right. So it's something that I talked about in a future show. Yes, Brazil nuts are, should I wait? I have to see my Facebook people. Just give me a second, guys. I have to be fair to everybody, Facebook and YouTube, if they've answered correctly. But don't worry, my team behind the scenes is also archiving all of your answers, so don't worry if I don't call you out and see your answer. Yes, Chad, you're correct. Hello to everybody. Thanks for tuning in. This is the Dr. Janine Show. We're in the quiz time right now and answering our quiz questions so that you have the ability to win one of our mugs. We have more prizes coming soon from our sponsors at VitaTree, nutritionals, so that's going to be fun. Okay, yep. Thank you very much. Now I see my commenting. Awesome. Okay. Aisha, no. Marie Thomas, you are correct. Harvarinder, you're correct. Yep, some of our fans are online. I can see this. This is awesome. Okay, so yes, it is selenium or selenium, depending on how you like to pronounce it. So selenium, Brazil nuts have, so eating 2 to 3 Brazil nuts is fantastic to support your thyroid gland, and that's really important for metabolism, for your body temperature. So that's great. So yeah, great guys. Okay, hello, Christian. Nice to see you. And Heidi, yes, helps with the thyroid. Chad, yes, coffee mugs. That's what the prize is for this week. And next week, maybe we're going to work on one of our new prizes. Okay, true or false? This is question number 4. And again, just try your best. Everybody, there's no excuse. You can put a true or false in here. Just guess, and you have the ability to win one of the mugs. Okay, air pollution affects women's fertility. True or false? Air pollution affects women's fertility. We talked about this, I believe it was last week's show. Do I have any answers? Facebook, let's see, YouTube. Okay, anybody? Natalie, you are correct. Harvarinder, you are correct. Reina, you're correct. Magnolia, you're correct. Chad, you're correct. Ray, you're correct as well. Dennis, yes, you are correct. And user 612, you are correct. Heidi, yes, good. all the users that are tuning in, make sure you change your username so that I can actually call out your name, because when it's a number, it's difficult. It's more difficult. Aisha, yes. Mary Thomas, yes, you are all correct. It's true. So yes, air pollution does affect women's fertility, and it's important to do regular detoxification to get those toxins out of the body when you are wanting to conceive. And that's something that I always shared with my patients at least 3 months before trying to conceive. Both man and woman does a full body detox. So we will share some links below in YouTube to a great detox product to help with a full body detox that doesn't have the negative side effects associated with most other detoxes. So that's awesome. Okay. Danny, you have a question. I'll get to that in a second. We are in our 5th quiz. So this is the final quiz question for today in terms of the Dr. Janine show. And here we go. True or false again. So everybody better participate in this one. Grains are part of the paleo diet. So it should be worded, can we eat grains on the paleo diet? Grains are part of the paleo diet. True or false? Daniel, no. User, yes. Heidi, no. Anybody else on Facebook? Natalie, you're correct. Anybody else? Naz, hello, nice to see you. Muskoka Mama, nice to see you. But no, you're incorrect. Balding, ugly, fat guy. You're correct. That's a funny name. Okay. Okay, anybody else? Marie Thomas, you're correct. Okay, so the answer is false. Grains are not part of the paleo diet. So the answer is false. Okay, I'm going to take a few more questions. Do I have the okay from my people behind the scenes? I'm going to take okay. Yes, my producer said I can answer a few more questions before we go to wrap up today's show. It's so great to see all of you online on TikTok. Hi, this is the Dr. Janine show. I'm Dr. Janine Bowring. So great to have you all here. And if you've got some health questions, we've got about maybe 5 minutes that I'm going to sneak them in. So I am going to, and congratulations to all of you who participated in the quiz. That was fun. We do that every single week. So question about blood in the stool. Wow. Okay, so I'm going to do a whole series on bowel movements. It's going to be really fun. My kids helped me with that one, so with some of the demos on that. So that's going to be fun. That will be coming up. I'm not sure if it's going to be, it might be in a couple of weeks. We can talk about constipation, blood in the stool. Definitely get it checked by your doctor. And anything that you see that I talk about here on the show, definitely you always want to consult with your doctor to ensure that you're in the best care and that you're taking care of things if it's something more serious. But blood in the stool can be hemorrhoids. It can also be something a little bit more serious, so definitely have that checked by your doctor. Okay, I had a question from Stephanie. And Stephanie saw a show and that I talked about magnesium stearate, and that she checked all of her supplements that they all contain magnesium stearate. So okay, what is magnesium stearate? And I promised to do a demonstration on this. Magnesium stearate is a flow agent that the industry uses in order to make supplements flow more quickly in terms of their machinery, so that they can get the powder, whatever raw material it is, the vitamin, the mineral, into the capsules more quickly. And it has never been tested for long-term human consumption to be safe. It is a chemical. The material data safety sheet says that you need to wear gloves and a mask, and yeah, everybody's wearing masks these days. Well, a lot of people are wearing masks just to handle magnesium stearate. And I have a problem with that, and I don't think, and it's in most of the supplements. And like Stephanie was saying, she said she was so angry because she had to throw away all of her supplements once she learned and did, about the magnesium stearate and learned about that for me. So I'm glad that you took some steps for your own health so everybody please check your vitamin bottles. If it says magnesium stearate or stearic acid or vegetable stearic acid, in my opinion, it's not a good thing. It decreases the absorption of what you're taking, can cause stomach stomach upset, some people say heart palpitations when they didn't know, why they were not feeling well. It was because of this flow agent in their supplements. So it's something that I do not like at all. Make sure you check all your supplements for magnesium stearate. And there's some other scary ones as well, like silicon dioxide, titanium dioxide. I promise that we'll do a show all about the fillers and supplements. I know a lot of people have questions about that. So we will definitely discuss that for sure. Okay, so any other questions? Hello to Aisha on Facebook, and nice to see you. Okay. Bowels, okay. Yeah, we will be talking about bowel movements. I promise. That's going to probably be coming up in a couple of weeks, and we'll discuss healthy bowel movements, what they should look like, and unhealthy ones, and what to look out for, and maybe some solutions as to how to help that. Okay, so Medusa is iron deficient and breaks out with pills. And okay, here's the problem with iron supplements. So this is probably one of the last questions I can answer. So iron supplements depending on the type of iron, and this would be a great future show that we can talk about answering this question, the different types of iron. So we talked about the different types of calcium today. In case you missed it or you're just tuning in now, will be on YouTube, so make sure you check it out on my YouTube channel, Doctor Janine Bowring. So iron, there's different types. Now, most of the time, if you're prescribed an iron supplement or you're getting it from a store as a supplement, it can be very hard on the stomach. And this is, why it's important that you make sure that you are always, getting an absorbable form of iron. And that's why I like iron bisglycinate, and of course, without the fillers and the flow agents. So we'll share a link below in YouTube. So make sure you're following my YouTube channel and that you're subscribed there and turn on the notifications so you always get our latest posts. But we'll share a link to a great iron supplement. That's a whole food iron supplement. It's a bisglycinate, meaning that it's not going to upset your stomach. It won't cause constipation. So talking about the poop, yeah, we did, and we will talk more about poop, I promise. But yeah, important that you find the right form of iron for supplementation, so it's not going to upset your stomach, and so that's a problem. Okay, any other questions? Marie Thomas is wanting to know about healthy lungs and congestion. Yes, okay, so deep breathing is one of the best things you can do for your lungs, and a full body detox. So that detox that I keep talking about, that full body detox, you want to be doing that at least 4 times a year to ensure that you're getting those toxins out of the lungs as well, being one of our internal organs. And people don't think about, they think about when we talk about detox or cleansing, you think colon cleansing, you think liver cleansing, maybe kidney cleansing. Nobody talks about doing lung cleansing, and that's why my favorite formulation contains some herbal medicines that support the lung tissue and help with lung detoxification as well, which is really, really important. I've had great, stories from people that have taken that as a full body detox, and they started to notice, a bit of coughing and wondered, okay, what's going on? Is that related? And absolutely, I explained that yes, because now that, whatever was sitting in the bottom of the lungs, you're actually expectorating and getting rid of that phlegm and those toxins that were deep down and probably sitting there for years from doing the full body detox. So that's the good news. And yeah, I promise that we will do some more posts on the lung tissue as well. Okay, so I think that's all we have time for. I know you have a ton of questions. I promise we will do this again. We do this every Monday. I will hop on TikTok live a couple more times this week to answer your questions. I know you have a ton of questions, but you can put them in the comments as well. I read all the comments. It's me who reads all the comments in TikTok. So when you're watching my TikTok posts, it doesn't even need to be about that subject that you're watching. And likewise on all the videos, just put it in the comments. If it's on YouTube or Facebook as well, I will answer everybody and do my best to answer your health questions, of course, doing it all naturally. And make sure that you're subscribed to my channel. Make sure you're following me on Instagram. Please give me a big thumbs up. And, always remember to take good care of your health and do it naturally. Thanks for joining me today.